Hello everyone and welcome to ASMR Ear and Skin. Thank you so much for joining us today. This video is made to help you relax, unwind, and enjoy the calming sounds of gentle ear cleaning and skincare ASMR. Sit back, take a deep breath, and let every sound guide you into a peaceful state of mind. We hope you have a soothing and satisfying experience. Don't forget to like, comment, and subscribe for more relaxing moments. When it comes to personal hygiene, many people think that cleaning their ears often is a sign of being neat and healthy. After all, nobody wants to walk around with dirty ears. But what most people don't realize is that earwax, medically known as cerumen, is not a sign of poor hygiene at all. In fact, earwax plays a vital role in protecting, lubricating, and cleaning your ear canal. That's why doctors consistently warn people not to remove earwax too regularly. Removing it too often can actually cause more harm than good. Let's explore the science behind earwax, why it's important, and what can happen when you try to get rid of it too frequently. 1. Earwax has a purpose, it's not dirt. The first thing to understand is that earwax is not waste. It's a natural and essential substance your body produces. It's made up of secretions from glands in the ear canal mixed with tiny bits of dead skin, hair, and dust particles. Despite its sticky appearance, earwax serves as your ear's first line of defense. Protective barrier. Earwax traps dust, debris, and microorganisms, preventing them from reaching deeper into your ear canal or damaging your eardrum. Antibacterial properties. Studies have shown that earwax has antimicrobial effects, helping to fight off bacteria and fungi that could otherwise cause ear infections. Moisturizer for the ear canal. Earwax prevents dryness and itching by keeping the delicate skin inside your ear canal naturally lubricated. In other words, earwax is like a built-in self-cleaning system for your ears. When you remove it too often, you're interfering with that natural process. 2. The ears clean themselves naturally. Your ears are one of the few parts of your body that actually clean themselves. Every time you talk, chew, or move your jaw, the ear canal's skin slowly pushes old earwax outward. Once it reaches the outer ear, it naturally dries up and flakes away on its own. This process happens gradually and silently. You don't need cotton swabs or any tools to help it along. When people frequently insert objects into their ears, like Q-tips, hairpins, or ear picks, they actually interrupt this self-cleaning mechanism. Instead of removing earwax, they often end up pushing it deeper inside, where it becomes compacted. Over time, this can lead to a blockage, the very thing they were trying to avoid. 3. Overcleaning can cause damage. Doctors often see patients who complain of ear pain, ringing, or hearing loss, all caused by overcleaning their ears. When you clean too aggressively or too often, you risk several problems. Irritation or injury. The skin of the ear canal is very thin and sensitive. Frequent cleaning can cause small cuts or abrasions, which may lead to infection. Compacted earwax. Ironically, trying to clean your ears can push wax deeper toward the eardrum, forming a hard plug that's difficult to remove without professional help. Perforated eardrum. Inserting objects too far can accidentally puncture the eardrum, causing pain, dizziness, and temporary hearing loss. Increased wax production. When the body senses that its natural protective layer has been removed, it may actually respond by producing more earwax to compensate. This creates a cycle where you clean more and more, and your ears keep making more wax. That's why doctors say, don't put anything smaller than your elbow in your ear. 4. Removing earwax too often disrupts your ear's natural balance. Your ear canal has its own delicate ecosystem. The pH balance, oil levels, and microbial population all work together to keep it healthy. When you remove earwax too regularly, You disrupt this balance. Without earwax, the ear canal becomes dry and itchy. The absence of protective wax allows bacteria and fungi to grow more easily, increasing the risk of infections such as otitis externa, also called swimmer's ear. You may experience a sensation of fullness, mild pain, or ringing as the sensitive skin becomes irritated. Ironically, people who clean their ears too much often end up visiting doctors more frequently because of the infections and discomfort they cause themselves. 5. What happens when you let earwax build up naturally? In most cases, earwax naturally moves outward and doesn't cause any problem. However, for some people, earwax can accumulate and harden over time. This may happen due to narrow ear canals, frequent use of earphones, hearing aids, or naturally dry wax. When that happens, you may notice symptoms like hearing that feels muffled or blocked, earache or discomfort, ringing sounds, tinnitus, itchiness or odor. If you experience these symptoms, it's important to see a doctor instead of trying to dig it out yourself. Doctors can safely remove excess wax using specialized tools or gentle irrigation methods that won't harm your ear canal or eardrum. 6. Safer ways to care for your ears. If you feel like your ears need cleaning, here's what medical professionals recommend. Wipe only the outer ear. Use a soft, damp cloth to clean the outer part of your ear. Never insert anything inside. Use ear drops if needed. Over-the-counter ear drops, like saline or mineral oil drops, can help soften wax and allow it to come out naturally. Avoid cotton swabs and sharp objects. These can cause more harm than good. Consult a professional if you suspect a blockage or have persistent symptoms. Let a doctor or audiologist examine and clean your ears safely. For most people, earwax maintenance is simple. Leave it alone. 7. Common myths about ear cleaning. There are several misconceptions about earwax that lead people to clean their ears too often. Let's debunk some of the most common myths. Myth 1. Earwax is dirty and unhygienic. Right pointing arrow false. Earwax is protective and normal. Its color and texture vary by person and don't indicate dirtiness. Myth 2. You need to clean your ears every week. Right pointing arrow false. The ears are self-cleaning. Most people never need to clean them at all. Myth 3. Cotton swabs are safe for ear cleaning. Right pointing arrow false. Swabs are the leading cause of compacted earwax and ear injuries. Myth 4. More cleaning equals better hearing. Right pointing arrow false. Over-cleaning can actually reduce hearing by irritating the ear or compacting wax. 8. The bottom line, less is more. Doctors agree on one simple truth: your ears know how to take care of themselves. The more you interfere, the more problems you may cause. Earwax is a natural, protective substance that keeps your ears healthy. Unless you're experiencing discomfort, hearing issues, or visible blockage, there's no need to remove it. By letting your ears function naturally, you avoid infections, irritation, and damage. So, next time you're tempted to reach for a cotton swab, remember, healthy ears are not perfectly clean, they're naturally balanced. 9. Quick summary. Earwax protects your ears from dust, bacteria, and dryness. The ear canal cleans itself, no tools required. Overcleaning can cause irritation, injury, or compacted wax. Earwax removal should only be done when there's an actual blockage or symptom. The safest approach: leave your earwax alone unless it's causing trouble. In conclusion, doctors say not to remove earwax too regularly because doing so disrupts your ear's natural defense system. Your ears are designed to self-clean, protect, and balance themselves. Interfering too often can damage this delicate system, leading to more harm than good. Sometimes, The best care is simply to let nature do its work.